Welcome to Integrity Linguistics Institute. So now let's begin with the discussion of this question. Right. So, yeah. All right. So good. So first and foremost, what is step number one? Step number one is comprehension, right? So this is step number one. So for under comprehension, you have to do the key word analysis, right? You have to do the keyword analysis, link the keywords together and try to find, the same keywords in the paragraph, even though it may be synonyms, right? Now, let's read the question over here. Nursing staff, right? So this is a workplace related question. Nursing staff can remove, okay, can remove a dressing if, okay, so a surgical dressing can be removed if, that means in one particular situation, okay, they cannot remove the dressing every time. So for example, a patient who is coming out of surgery, they will have a lot of dressings, right? So the nursing staff, under any situation, they cannot remove it. Okay, they can remove it only in particular situations, right? So the question is asking you in which situation. Okay, so this is a policy over here, right? According to the hospital policy, okay, the hospital is giving certain instructions, okay, regarding post-operative dressing. That is, patients who have completed an operation, they will have post-operative surgical dressings, and in which situation nurses are allowed to remove a dressing. They are not allowed to do it anytime, anywhere, only under certain situations, right? So this is a policy type question. Okay, a policy or a procedure type question. So A, B, C. Okay, situation number one, nurses can remove the dressing if a member of the surgical team is present. Okay, so if there is one member, okay, one member of the surgical team, so the people who conducted the surgery, okay, if that person is present, then in their presence only in their presence, the nurse can remove the dressing. Okay, this is the first instruction or first, expectation from the nurse according to the hospital policy, right? Second, that is answer option B. Okay, they can remove the dressing if there is severe leakage from the wound. So the patient is having a wound over there, a surgical wound, and from the wound there is severe leakage, like blood and pus and all is, coming too much. In that situation, only the nursing staff can remove. Otherwise, they cannot remove. Answer option C, they believe that the wound has healed. Now, who is they over here? Who is this they? Can anyone type the answer in the chat box? Who is this they over here? So who's this they? Yeah, the nurse, right? So the nursing staff, okay, the nursing staff is basically, they are using as the pronoun over here. So this is a pronoun, which is, so this is the connection over here. Right. So very good. Right. The nursing staff. Very nicely done. So sometimes the OET is very lazy. They will use these type of words and you have to understand what those words are referring to. Right. So now what is the stem of the question? So now we have read the question. We have analyzed the keywords. Let's identify the question stem. Nursing staff can remove a dressing if. Okay. So here the stem of the question is this one. They can remove the dressing if it is going to be answer option A, B, C. So in which situation are nurses allowed to remove a dressing? Right. So what is answer option A? A member of the surgical team is present. So here, what I'm going to teach you is what we call as the verb analysis. Okay. Verb analysis is extremely important for you to refining your elimination strategy, right? So this is extremely powerful. So what is a verb? So those are a little bit new to my sessions. What is a verb over here in English grammar? A verb is basically any kind of an action, right? Any kind of an action, any kind of a movement. Okay, this is what we usually term as a verb over here. So give more importance to verbs, right? And that strategy is what we call as the verb analysis. So what is the verb in answer option A? A member of the surgical team is present. So what is the action over here? Someone is present, right? So my presence, so I am present for my students. So that is the action I'm doing, right? So this is the verb over here. Okay, so they can, so now you have to, so this is the verb analysis. And who's present over here? A member of the surgical team. Okay, so that these are the keywords and these are the verbs, right? So they can remove if a member of the surgical team is present. Now, what is the action in answer option B? What is the movement or action? What is the verb in answer option B? There is severe leakage, right? So when there is severe means intense leakage from the wound, then in that situation, they can remove the dressing over here. So what is the action? What is the verb over here? Severe leakage. So they can remove when there is severe leakage, right? Now, what is the action in answer option C? They believe that the wound has healed, right? So this is the action over here. The wound has healed. So they can remove the dressing if they believe that the wound has healed, right? So like this, you have to analyze the verbs, and this is what we call as the verb analysis. Extremely powerful and super effective for you to refine your elimination strategy, because here you have to not only choose the correct answer, you have to also eliminate the incorrect answer options, right? So now you see it is a little bit smaller, right? So nurses can remove if someone is present. Nurses can remove the dressings if there is severe leakage. The nurses can remove if the wound has healed. Now you see, only small words we have to keep in our mind. So this is going to help you in your retention, right? So what is retention? Retention is basically registering the info to your memory, right? So you have to register this information to your memory, right? This is what we call as retention. So now it is very easy to remember these small words, right? Someone's presence, severe leakage, wound has healed. So this is how you can save time and also improve your accuracy and improve your reading speed, right? So now let's come to this. So we have to have the memory of the question. So with that memory, with that clarity, with the question stem knowledge, okay, now you have to come and do the reading part, right? So now we are going to analyze the text over here. So let's read the text over here, right? So text over here is post-operative dressings. Okay, so these are what type of patients? Patients who have completed an operation, post-operative, right? So here they have mentioned dressings are an important component of post-operative wound management. So here they're telling surgical dressings, they are extremely important, okay, for post-operative wound management. Now see, what is the question asking you? The question is asking you, what is the question stem? Okay, under which situation can nurses remove dressings, right? So remember, this is the question stem, right? Under which situation can nurses remove the dressing? You must never forget this question stem. Question stem, you must never forget. Now see, what is the first question over here? The first question over here is, dressings are an important component of post-operative wound management. Now you see, there is nothing related to removing dressings. There is nothing related to situations, right? And there is nothing related to nurses as well. So these type of information, okay, you can say does not contain the answer. So like this, you must be able to identify which information are distractors. See, the OET will have useful information and the OET will have useless information. So the useless information are what we call as distractors, right? These are trying to distract you, but you must not fall victim to it. You must know the keywords. Okay, for me, in which situation nurses can remove the dressings. That is the only thing that is important to me. Nothing else matters. So I don't want to know whether dressings are important for wound management role. So that's a distractor. So you should not give that sentence any importance. This is how you should be able to read so that you can give more importance, more attention to the the essential information and find the answer. Right. So let's keep reading the from the second sentence onwards. Any dressings applied during surgery. Now, see, this is during surgery, okay, have been done in sterile conditions and should ideally be left in place. Now, what is the second sentence telling? The second sentence telling any dressing applied during surgery. So, when the surgery is being done, the surgeons will apply dressings, right? In which conditions have they done? They have done in sterile conditions, which means there is no bacteria, there is no virus. It is extremely hygienic, sterile, very clean conditions. And here the guideline is telling and should ideally be left in place. Left in place basically means what? Keep it like that. Okay, left in place means the position of the body part of the patient, right? Left in place. So what is the place means what? Place means what? The location, right? What should be left? See the item. So what is the item over here? The item over here is the dressing, right? And what is the place over here? The place is the where the dressing is located. So that is the body part of the patient, right? Body part of the patient, right? So if the dressing is on the arm, then that is, so what is the meaning of this? What is the meaning of left in place? The meaning of left in place basically means the dressing should be kept in the same, no, should, the dressing should not be removed. Okay, left in place means should, UD should not be removed from the body of the patient. So this is the meaning of this phrase. So how many students understood that? Left in place. Left in place basically means that the dressing, okay, the dressing over here, it should not be removed from the body of the patient. So the OET will use these type of phrases, right? So these type of phrases and all, they will be used, okay? And you must be able to understand the meaning, okay? Left in place means the dressing, the item should not be removed over here. And this is the ideal. Ideal basically means what? Ideal basically means perfect. Okay, so the perfect situation is after surgery is done, do not remove it. Keep it like that. Okay, as stipulated by the surgical team. Right? So this is how you have to understand the meaning of this particular sentence and go. Totally, yeah. Yeah, totally meaning will change. So left in place, right? It should be kept in there, right? As stipulated by the surgical team. So this is how you have to understand that the OET has a lot of layers into it. Right. Now it is acceptable. Okay. Now again, so what's the question stem? The question stem is when can the nursing staff remove a dressing? So still we are waiting for the removing part, and we are also waiting for in which situation it can be removed, right? So these are all distractors. We are still waiting for the answer. Right. So let's wait. Let's keep reading. Now saying it is acceptable for initial dressings to be removed. Okay. Now we are waiting for the answer for the keyword. Now the main keyword is coming, removed, right? So now it is saying it is acceptable, means it is okay. It is okay for initial dressings. Initial means the beginning dressings. Beginning dressings to be removed prematurely. Prematurely basically means what? See, the surgical team will tell, don't remove the dressing for 2 weeks. Don't remove the dressing for 3 weeks. Okay. But in some special situations, we can remove the dressing prematurely. That is, the surgeon is telling you have to remove the dressing only after 2 weeks. But in very special situation, we can remove it before 2 weeks itself. But it has to be a special situation, right? Removed prematurely in order to have the wound reviewed. So the situation is to review the wound, and in certain situations, apply a new dressing. Okay, so here they're telling, yes, to review the wound, that is to check the wound, and also to apply a new dressing, we can remove the thing, or the dressing over here. So it can be allowed. So nursing staff can remove the dressings. What's the first reason? To review the wound. That is reason number 1. What is the second reason? To apply a new dressing. Right. Now we are still waiting for the answer. So we have some idea. Okay, so review the wounds and to apply a new dressing, it can be allowed. Right. Now let's keep reading. So it is a continuation of this information. And here they're telling these situations include, okay, so a situation, that is the question stem, right? So in which situation can these things be removed? So that is the question stem. So don't forget, this is the question stem. So this is what we have been waiting for. In which situation can we remove the dressings prematurely? So that is what we are waiting for. So here they're telling these situations include when the dressing is no longer serving its purpose. Okay, so what is the purpose of a dressing? What is the purpose of a dressing? To protect the patient, right? To protect the patient from contamination, from germs, bacteria, viruses. Okay, that is the purpose of a dressing. So what happens if the patient is going and playing football in the drain? The patient is going and playing football in the rain. What will happen? The patient is having dressing, but the dressing is no longer serving its purpose. Okay, the dressing is compromised. So in that situation, we can remove the dressing. Okay, that is, and see over here, dressing falling off. So the dressing was not applied properly. The dressing is falling off. So if the dressing is falling off, in that situation, what can the nursing staff do? They can remove the dressing, right? And what's the second situation? Excessive exudate soaking through the dressing. Excessive exudate basically means what? It is discharge. Okay, the blood, the pus, the fluids that comes from the wound, that is what we call as exudate. So that is a what you call it? That's a medical term. So if there is too much blood, too much pus coming from the dressing, that is second situation. So in that situation, we can remove the dressing. Okay, and if it is resulting in a suboptimal wound healing environment. Now, what's the meaning of suboptimal? So I'm going to give you some vocabulary today. Optimal. Optimal basically means what? Optimal means best, right? And standard. Okay, so another word, standard over here basically means like gold standard, we'll say. Okay, so we'll say like really good. Okay, really good. So high standard coaching means really good coaching, right? Now what's the meaning of substandard? Okay, so I'm not talking about myself, I'm talking, just giving you an example of it. So substandard basically means what? Substandard basically means low, not good. So you might have heard, right? You might have substandard product. Okay, this product is substandard. Now, what's the meaning of suboptimal? Now tell me, what's the meaning of suboptimal? Suboptimal means it is not the best. Okay, it is below best. Suboptimal. Sub basically means below. Right. So you really, yeah, not best, right? So this is what you need to understand. Suboptimal wound healing. So what's happening? Okay, so if there is too much blood, too much things coming, then the wound healing environment, it is reduced. Okay, it is not a perfect wound healing environment. So in that situation, we can remove the dressing, or when a wound complication is suspected, or else when there is a complication suspected, in that situation, we can remove the dressing. So what are the situations? So what's the question stem asking us? In which situation can we remove the surgical dressings, right? Situation number one, dressing falling off. That's the first thing. Second thing is there is excessive exudate. Excessive exudate soaking through the dressing and resulting in a suboptimal wounding environment. The third thing is when a wound complication is suspected. So in these special situations, only in these three special situations, a nursing staff can remove the dressings over here. Right. So let's now go to the paragraph over here. What is answer option A telling? A member of the surgical team is present. So see, on our examination day, you will not get this much time over here, right? Now, what is the verb over here? The verb over here is present, all right? A member is present over here. So in which situation can the nursing staff remove the dressing? So according to answer option A, nurses can remove the dressing if a member of the surgical team is present. Now, did we read any of these things? So did we talk about a member? Did we talk about did we read anything about a surgical team present? No, right? So the keyword and the actions, the keywords and the verbs are not mentioned over here. So since it is not mentioned and it is not at all related to the answer, we can eliminate answer option A, right? So this is how you have to eliminate the incorrect answer options. Now, you know, it is either B option or it is C option. Now, what is B? What is the action over here? What's the verb in answer option B? There is severe leakage, right? So from the wound, there is severe leakage. Now, is that mentioned? Now, see the word keyword, right? So the keyword over here is wound over here. So that is mentioned. And what about the severe leakage? That is also mentioned, right? As you can see, if you go over here, excessive exudate, right? Excessive exudate basically means what? Severe leakage, right? So we can say that that word is also mentioned, right? So we can say that answer option B probably could be the right answer. So you can, again, B is indeed the right answer, but we have not yet eliminated answer option C. C we have not yet eliminated, but this word severe leakage is definitely mentioned. So you can say, okay, B could be the right answer. Now, what is the action in answer option C? That the wound has healed. So did we hear or did we talk or did we read about anything about wound has already healed? No, right? We have not yet, we do not read anything like that. So we cannot choose answer option C, right? So the right answer option is going to be answer option B, right? So this is how the verb analysis will help you out in the examination day, right? So this is the answer to the first question over here. That is, a nurse, in which situation can nurse remove the dressing? They can remove the dressing only if there is severe leakage. And see, they have used synonyms, right? They have not repeated the same words. They have used synonyms over here. Excessive exudate, soaking through the dressing, severe leakage from the wound. And this is the connection over here. All right. And we can say for that reason, B is the answer. And this is not mentioned. This is not mentioned. So A and C are wrong. Right. So now what I'm going to do.